I am professor of obstetrics and gynecology at Stanford University School of Medicine, where I practice pediatric and adolescent gynecology. I've been doing pediatric and adolescent gynecology since I first joined the faculty at the University of Virginia in 1984, so several years. And I'm also the editor of a recent textbook. It's called Practical Pediatric and Adolescent Gynecology. And a number of my colleagues have contributed to this textbook. And as usual, I learn from my colleagues, and in particular, some colleagues who have some expertise in legal issues, which is important as we think about pediatric and adolescent gynecology.
Thank you, Dr. Hillard. We're very pleased to have you talking with us today. Can you tell us what are some of the laws now that OB-GYNs need to be aware of when they are treating adolescents?
So I wish I could tell you about every state law, and I have to, of course, give the caveat that I am not an attorney. I'm not a lawyer, and it is challenging to keep track of the laws. Every physician really needs to know about the laws in his or her own state, and one of the resources that clinicians can use to do that is through the Guttmacher organization. So the website guttmacher.org has a really excellent listing by state, and as I looked at it this morning, it's just been updated July 1st, 2015, about the laws related to reproductive care for adolescents by state. And so I think that's a good place for clinicians to start, to find out a little bit about their laws for each state, but very important because they really do vary. For the most part, laws protect, in general, confidentiality for adolescents, but there are a lot of specific circumstances that may apply, and thinking about them is important. A couple of sort of generalizations that, for the most part, adolescents have the right to confidential care for evaluation of STIs. And so that is one area where the laws are relatively universal, although again the specifics are important to note, and knowing those specifics is important. Our major professional organizations, ACOG, the American Academy of Pediatrics, Society for Adolescent Health and Medicine, these organizations, professional organizations, really support adolescents' right to confidential care, the AMA as well. And so that right to confidential care is pretty important because there are a number of surveys that have shown that if adolescents aren't assured confidentiality, then they may forego the medical care that they really truly need. So clinicians need to help adolescents to obtain the health care that they need. And one of the ways of doing this is by discussing confidential care with their individual patients, and when appropriate, discussing that right that adolescents have to confidential care with their parents as well, in a way that isn't confrontational, but lets the parent know that the clinician's goals are the same as the parent's goals, that the teen would be healthy and be able to get and stay healthy.
That sounds as if it could be a challenge sometimes. Can you give an example of a way you would present to a parent, perhaps a teenager is coming in for contraception? How do you balance the duty you feel toward your patient and also the duty you feel toward a parent of a minor?
So there are several ways of doing that, and one of the ways that I do in my practice when a teen initially comes to me, often she does come with the parent, and I have a consultative practice so that the problems may not be stated that they're for contraception, but the structure of the visit I think can help. So typically I see mother and daughter, and it's almost always mom, but not always, but mother and daughter together initially. And then I explain to them together that I will see the mother for a few minutes privately, and I see the mom first before I see then the daughter privately. So I explain the structure, see the two of you together, then I'll see mom for a few minutes, and then I'll see you, the daughter, for a few minutes privately. And so I explain it sort of generally initially, and then in talking to the mom, I do explain that I will answer any question that her daughter has, that it's important for girls to have information on which to base their decisions, so that I will answer any question that she has, and that I do explain that I will do that confidentially so that her daughter's health needs can be met. And almost all the time, that is acceptable to the mom. Honestly, I've had only a handful of moms over my 30-some years of practicing who say that's not acceptable.
Mm-hmm.
And again, I will still answer that daughter's question, because certainly in my state, the daughter has that right to confidential care. And I explain similarly to the daughter that, again, within the laws, that the things that she and I talk about are private and confidential. I usually say what that means is I'm not going to say to your mom, can you believe the dumb questions that she's asking? So a relatively neutral kind of a question in general. But then I do go on to say that there are legal issues that I must report. So if I'm concerned that you are going to hurt yourself, if I'm concerned that you're going to hurt someone else, or that someone is going to hurt you, then legally I'm required to report those kinds of things. So that's kind of the spiel that I give to the daughter privately, and I do that before we talk about anything, actually. So that's the first, one of the very first things that I say. I usually first say I'd like to get to know them a little better, and then explain about confidentiality.
Right. Well, that makes sense, and it sounds very reassuring to patient and to the parent. And so, I suppose what you're saying is know your state, because it does differ quite a bit, the confidentiality laws, and then know your patient and the parents too, right?
So I think that it's not always the case that a teen is with a parent, but parents for kids under 18 need to give consent for treatment, so that in some way or form for pediatric care, the parents are giving their consent.
Right.
So that's something that always needs to happen. There are certain situations that are a little more complex. There's such a thing as an emancipated minor, for example, teens in the military, and issues of that sort that are a little more complicated, that need to be addressed. And there is a chapter in my practical pediatrics, pediatric and adolescent gynecology textbook that really reviews that very carefully and in a way that I think is very helpful. But clinicians, if they have questions, should seek legal advice for their state.
Sure. Right. Well, thank you so much, Dr. Hillard. We really appreciate it.
You're welcome.
Thanks.
My pleasure.
Bye-bye.